Now, let's look at kind of some of the things that happen, right? To kind of give you a visual of what can happen with chronic mold and mycotoxin exposure. So one of the things that happens with exposure, so again, remember I said earlier with the mold, you could be allergic to mold. Okay, you could have an overgrowth of mold, or you could be being poisoned by mycotoxins. They're different. Each one of these things is a different thing, and this is why so many people don't get it figured out, and so many doctors kind of unfortunately mislabel folks. They stop here. Again, your immunologist, your allergists are generally going to do a skin prick test to look at allergy, and if you don't have that, they completely dismiss mold as a potential issue. But when you're exposed to mold and mycotoxins, it's going to create inflammation, right? I mean, that exposure is going to create an inflammatory process. But it's important to understand mycotoxins particularly, they inhibit your ability to form new DNA and new RNA. And actually, that's not all. They also inhibit protein synthesis. So this has been very well researched and very well established. So we know that when you can't make protein very efficiently, and when you're not making DNA and RNA effectively, guess what happens? You lower your capacity to heal and repair. Your body heals and repairs every day. You go to bed at night so that you can heal and repair, right? That's part of what sleep is all about. But if your DNA and RNA and your protein synthesis is being inhibited, how effective do you think you're going to heal or repair from the day before, right? Now multiply that over 6 months, 12 months, 5 years, 10 years. You've got major problems. You're not healing, you're not repairing. So this inhibition leads to a lot of major problems. And one of the problems associated with the exposure is cancer. There are several forms of cancer that have been linked to mold, chronic mold toxicity and mold exposure. And part of the reason why, again, when you can't repair, the cells start to change. They become abnormal and they develop into a cancerous line of cells, and that can really impact you. Follow the line up, right? You see, when these things happen, the other thing that happens is a weakened immune system. So this is especially true of mycotoxins. What are mycotoxins? Mycotoxins are metabolites. They're secondary intermediary metabolites that mold produces. And why? Why would mold want to produce a mycotoxin? Because mycotoxins, when they go out into the world, they suppress life of other life forms. It's part of the job. That's part of how mold can replicate and grow and get stronger, is it suppresses other life forms in its area. It uses mycotoxins as a vehicle to suppress other bacteria, to suppress other life forms so that it can get a foothold and grow and replicate and become stronger. And so if you just happen to be that life form, right, those mycotoxins, you're going to experience the weakened immune system that can come from that. Now understand that mycotoxins are roughly 0.2 microns in size. This is tiny. You can absorb them through your skin. So you could be fully clothed. That's why when you see people going to clean up mold damaged buildings, they're wearing Tyvek suits, right? These full-on, what looks to be like a chemical warfare gear, right? They're wearing these full suits and full respirator masks. Why? Because they're protecting their skin, the surface of their skin, from this absorbing through their skin, because it can go right through your skin and it can get into you. It can get through your eyes, it can get into your nose, into your lungs when you breathe. And so that's why the respirator, and that's why the Tyvek suit's very small. But they weaken the immune system through the inhibition of DNA and RNA, right? And when an immune system is weaker, one of the things that you're more susceptible to developing is bacterial and fungal infections. So both can be true. And this is what we'll see clinically, is a lot of people will develop gram-negative types of bacteria. They'll have a plethora of gram-negative bacteria producing toxins. Remember, some of these gram-negative bacteria produce what are called LPS, lipopolysaccharides. These are chemical toxins produced by these bacteria that can damage the liver. And they're also linked to leaky gut. So a lot of people say, Dr. Osborne, how do I heal leaky gut? I'm doing everything right. My diet's right. If you've got persistent leaky gut and liver damage and problems that won't go away even though you've changed your diet and your lifestyle, you've got to start looking toward the environment as the potential, and the environment of the potential for mold or mold problems. Yeast overgrowth, again, I was talking earlier about this, right? And that, secondary overgrowth of yeast is a result of the opportunity that the yeast have. They take advantage of your weakened immune system and they get a foothold. And so what happens a lot of times when you see, bacterial infections, you get an antibiotic typically, but yeast infections, you also get an antibiotic because doctors don't do cultures these days. They don't do their diligence, and so they just write the antibiotic, and guess what? The antibiotic then disrupts your microbiome, right? And that further weakens and disrupts your ability to protect yourself. Remember, your microbiome, you're outnumbered 10 to 1 by these life forms that live inside of your GI tract, and what do? They help you digest your food. They help you make vitamins. They help seal your gut by producing a substance called mucin. But also importantly, they're regulators of your immune response. And so if you have a disrupted microbiome from chronic antibiotic use, but also from mycotoxin poisoning, right? Because mycotoxins can also disrupt your microbiome, right? So it's like a double hit. The mycotoxin creating the immune suppression, creating the yeast overgrowth that's treated improperly. You further get disruption. You further get an immune system that doesn't know what to do. And this is where, when we amplify this up over years, what we really are talking about is autoimmune disease and cancer, right? And so it's important to understand that autoimmune disease comes first in most cases. And autoimmune disease, that way I would like you to think about autoimmunity, is it's pre-cancer, right? It's a form of pre-cancer where your immune system is basically on overload trying to deal with all these things that are going on, right? And then the process of this multiplied over years, you still get an abnormal cell line that manifests and turns into cancer. And so that's where the big dangers are, right? Because, once you get cancer, it's, if you go traditional, it's chemo, it's radiation, it's surgery. Most people that get cancer treatment don't die from their cancer. They die from the treatment of the cancer, which is quite preposterous when you really think about it. And same thing here with autoimmune disease. Most people, with autoimmune disease, their immune systems are being suppressed with the heavy drugs that they're being put on, and those heavy drugs also contribute to cancer because they're immunosuppressive. And so again, it's kind of the same pathway. So you don't want to end up here. This is like the worst place to end up. So if you suspect mold as part of your issue, you've got to go backwards and you've got to look at, several things. You've got to measure yourself. You've got to make sure that, one, are you allergic to mold, and are you surrounded by mold in your abode, in your home? Do you have mycotoxin poisoning? Beyond that, is that leading to opportunistic overgrowth of yeast, right? Creating the perfect trifecta for a moldy yeast bomb in your body. And then secondarily, you've got to get your house checked out. And maybe it's not your house, but if you go to work every day and feel worse, or if you come home every day and feel worse after a long day of work, pay attention. Those are clues, those are insights into, your environment might be poisoning you directly. And mold toxins are no joke. They're super dangerous, and you do not want to be exposed to them over long periods of time. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.